One point that you raised, the Congressional Budget Office does say that under this bill, premiums will go up.
Mm-hmm. Well, there are differences.
You're nodding your head, but
there are differences of opinion as to whether or not the Congressional Budget Analysis is correct on the increase in premiums. But the important thing here is that I hope we can all agree that we have to get rid of the profit-driven, insurance company-driven health insurance system that we have, where it's insurance company bureaucrats, Senator Coburn, that are getting in between patients and their doctors. To suggest that this bill will put government in between patients and their doctors is really disingenuous. Right now, it's insurance companies that drive. Right now, it's insurance companies that drive health insurance.
Private insurance denial rate is. Now, think about that. Medicare's denial rate on claims is twice. It's 6.5%. The average insurance is 3.5. Look, I've dealt with the insurance industry. I know how bad they can be. I don't want to eliminate them. I want to make them transparent and accountable.
But not the way Republicans suggested we should change Medicare to be a voucher system.
I want to bring this back to
change Medicare to a voucher system, as Republicans
excuse me for a second. I want to bring this back to another controversy we had this week over the cancer guidelines because it connects to this point in the patient-doctor relationship. You and several others were critical of the guidelines, saying that this is that under the president's plan, under the Democrats' plan, it's going to lead to more rationing. Yet the American Cancer Society says that the Republican alternative is worse, would do more harm than good, wouldn't give preventive services to anyone, and that under these bills, preventive care is encouraged and actually required by insurance companies. So isn't that an improvement?
Well, actually it is not. And the guidelines that came out this week by the Preventive Services Task Force have a direct link to what would be offered if the House and the Senate bills were to go into law, if they were to be put into law. And George, this is exactly how it happens. If you go to page 1296 of the House bill, the engrossed copy, and you begin to read in Title 3 of that bill on preventive and wellness services, and you get down to Section 2301, this is what happens. In Section 3131 of that bill, it changes the Preventive Services Task Force to the Clinical Preventive Services Task Force. Then you go back and you see that that task force on preventive clinical services is tasked with rating A, B, C, D, or I all preventive services. Then you go back into Section 222 of the bill, and it says, yes, I have read this bill, and that indicates what will be paid or covered. And this is where the actual link comes, and I'll read it for you. In Section 2301, it says, all recommendations of the Preventive Services Task Force, that's the group that did the mammograms, and the Task Force on Community Preventive Services, as in existence on the day before the date of the enactment of this act, shall be considered to be recommendations of the task force on clinical preventive services.
The point is that the guidelines
they become the law.
They
become the law, the mandate.
No, they would not be. And
yes, they do.
What's unfortunate is that the Republicans and Ms. Blackburn have, for the first time, politicized breast cancer.
That is incorrect.
No, it is not. And I'm
as
you know, as a breast cancer survivor, Marsha.
It's in the bill, Debbie, and I have great respect.
As a breast cancer survivor, I came out against these recommendations. Every major cancer organization has come out against these recommendations. The task force language in that bill actually makes sure that preventive services like mammograms and colonoscopies and other cancer screenings would be free. The task force recommendations, the language in the bill ensures that more women would get access to preventive screening.
Excuse me for a second. That is true, but let me clarify a little bit, because under the bill, and we have the language as well, it says that a group health plan and health insurance issuer offering a group shall provide coverage, but only under if the Preventive Services Task Force rates it as an A or B.
That's right.
And actually, under the task force, they said that these mammograms for women 40 to 50 is rated C, so they actually wouldn't be covered. So you'd have a great expansion for a broad part of the population, but actually these guidelines would be controlling for ages 40 to 50.
This task force's recommendations are simply recommendations. They aren't controlling.
As a physician who's been out there in this,
they aren't going to be binding. Their recommendations.
Well, but the language here says they wouldn't be binding on that issue.
Here's the question we ought to be asking. Do these recommendations make sense from a cost standpoint? Absolutely. From a cost standpoint, they're right. You look at the statistical analysis, they make sense. from a patient standpoint, they're atrocious. And that's the problem with a bureaucracy stepping between a physician and their patient.
Can you weigh in on this?
Well, absolutely. I worry about a government-run plan that would be subject to recommendations that might be applied universally without respect to patients. I am concerned about that. It's not that you can't fix some of those concerns, but you can't fix every one of them, and I am concerned that if it's turned over, look, the insurance industry has its own challenges, and many of those can be handled with transparency and by eliminating pre-existing conditions and rescissions and rating based on health and some of the other ratings, gender ratings. But we're not going to, if we can keep as much of it at the state level as possible, you've got patients' Bill of Rights, you've got all kinds of mandated coverages, and this can be handled on a state-by-state basis. It gets lost in Washington in a big government-run plan, and I don't know what happens.
But if you don't have these kind of guidelines, how are you going to get the cost control you were talking about?
I don't mind guidelines and recommendations, but I don't want them to become the equivalent of rules and law.
And we have to make sure that we're not forgetting about the people. And that's what the task force forgot about this week, is that we're not thinking about big amorphous blobs of people. These recommendations say that we can trade one life to save the angst and anxiety in a larger group of women. And that's totally inappropriate, but that's also why major experts, medical experts, the Cancer Society, the Komen Foundation, all came out against this.
Well,
and that
still
won't be controlling in the final legislation.
No.
So you're saying the legislation's going to be changed?
But Marcia, I would invite you.
You know what? I think you and I need to work together on a motion to instruct and get this language out of here, because on page 1318, it does mandate it. It
Marcia,
says that the HHS